Hello, my name is Dr. Tariq Kapasi. I am a GP working in Leicester City. This patient education video is to talk about coronavirus in Leicester, brought to you by Willis Health and the Leicester Primary Care Networks. During this video, we're going to cover what has happened locally, how you can protect yourself, when you should test yourself, how you can book a test, and what to do if you test positive. We'll also talk about what help is available to you and your family. What has happened? There has been an increase in positive test results for coronavirus in Leicester. This is both challenging and frustrating after months of sacrifice. We need to keep on doing what we've been doing for a little bit longer. We must all take action to help stop the spread of coronavirus, protect our community and the NHS. Stay at home as much as possible, leaving only for work or essentials such as food shopping, attending a doctor's or hospital appointment, or caring for others. Keep 2 meters apart from people outside of your household at all times. Wash your hands regularly for at least 20 seconds using soap and water. Limit your contact with other people. Don't meet up with people in their homes or any indoor space. And make sure you wear a face mask on public transport, your GP surgery or hospital appointment, or any confined space. This part of the video is information on shielding groups. Shielded patients are those who are extremely vulnerable because they have an underlying disease or health condition that puts them at risk of severe illness if they catch the coronavirus. This group are advised to shield at home. All patients who are shielding should have received a letter from the government dated 22nd of June. This explained national shielding guidance for England is being relaxed on 6 July. You should not follow the national relaxation of shielding on 6 July. What does this mean for shielding groups? Stay at home as much as possible and keep visits outside to a minimum. If you wish to spend time outdoors, you can do so with members of your own household, or if you live alone, with one person from another household, ideally the same person. You should try and maintain social distancing and avoid gatherings of any size. You are advised not to be part of a support bubble with another household. Shielding and work. The letter you have received on 22nd of June will continue to act as evidence for your employer to show that you cannot work outside your home until 31st of July, including for statutory sick pay purposes. You do not need to speak to your GP to obtain an updated letter or medical fit note. When do you get tested for the coronavirus? You get tested when you have the first sign of symptoms. This can include a high temperature, or a continuous cough, or a change in sense of taste, or a change in sense of smell. You should also get tested if you have had close contact with someone who has had symptoms. Please get tested as soon as you can. How do you then book a test? It is very easy to book a test. You can call 119, or you can go to the NHS website and ask for a coronavirus test. There are lots of test centres in the city. What do you do if your test is positive? You should stay at home for 7 days. Anyone you live with must stay at home for 14 days. What do you do if you feel unwell? Most cases of coronavirus are mild. However, some people can become very unwell. You can seek advice by going to the NHS website. You can also call NHS 111 where you may be redirected to your GP. If you do need to see a doctor, then a face-to-face assessment will be booked for you. This may not be at your normal GP practice. This is to protect you. Remember, if you have any other symptoms for which you would normally see a doctor, you should contact your GP surgery. This is so your other medical problems are assessed by a doctor before they become worse. If you feel very unwell, then you should call 999. How can you seek help in self-isolation? We can understand this is a difficult period. You can seek advice and support to vulnerable residents from the Leicester City Council. If you need support to get food or other essential supplies, if you need help to pay for fuel, rent, council tax or other bills, or if you're concerned about a resident who is vulnerable or isolated, you can contact Leicester City Council support on c19support@leicester.gov.uk. If you want to email this address, then please try and include a telephone number, or call 0116 454 1000. A member of staff will call you back between 9:30 and 4 p.m. Monday to Friday. There are other ways you can seek help in self-isolation. Supermarkets have priority delivery slots. If you've not yet registered for support, you can call 0800 028 8327. You can also contact the NHS Volunteer Responder Scheme. They can help collect your shopping, medicine, or other essential supplies that you need delivering to your home. If you would like someone to check in with you, if you would like a chat, you can call 0808 196 3646. We understand that the coronavirus pandemic may be leading to financial challenges. Some of these local organizations can give you free, independent and confidential advice on debt, budgeting, housing, employment, family issues and community care. During this pandemic, your mental health can also suffer. You can seek help with your mental health by going to Mind and calling them on 0300 123 1393. You can also talk to the Samaritans, who are available 24 hours a day, 7 days a week on 116 123. You can also refer yourself to psychological therapy, which is talking therapy. You don't actually require a GP referral for this. You can refer yourself by calling 0116 292 7010, or you can email Leicester Open Mind at notshc.nhs.uk. You don't need a GP referral, but you can access help from your GP if you are experiencing a worsening of your mental health. You can seek help with domestic violence or sexual abuse by ringing United Against Violence and Abuse on 0808 80 20028, or Relate on 0300 003 0396. Elderly people can seek support through some of the channels I've already discussed through this video. That includes accessing support through the Leicester City Council, accessing the NHS Volunteer Service, or calling Age UK on 0116 299 2239. In summary, there is a spike of cases in Leicester. We need to continue what we're doing. By following the advice we have given, we will allow the lockdown restrictions to lift. Protect yourself. Get tested if you have symptoms. It's easy to get tested. There is also lots of medical, financial, social and mental health support available. Finally, during this pandemic, it is important to remember we are all in this together. Thank you for listening.